organophosphates, carbamates, then barbiturates, benzodiazepines, carbolic acid, late ethanol poisoning, and pontine hemorrhage. Amongst these, please remember that barbiturates can sometimes also cause mydriasis. Barbiturates sometimes can also cause mydriasis. Now coming to organophosphates poisoning, it's very commonly asked in India because it's a very common poisoning in India. Examples of organophosphates are also asked. Tell me, okay, now you tell me, malathion belongs to which class? Alkyl organophosphates or aryl? Alkyl organophosphates. Parathion. So organophosphates are basically of two types: alkyl organophosphates and aryl organophosphates. Examples of alkyl organophosphates are TEPP, tetraethyl pyrophosphate. TEPP, tetraethyl pyrophosphate. Number 2, OMPA, octamethyl pyrophosphoramide. Octamethyl pyrophosphoramide. OMPA, octamethyl pyrophosphoramide. Then HETP, heptaethyl tetraphosphate. Heptaethyl tetraphosphate, HETP. Then sulfotep, tetraphosphate. Then Dinefox, Demeton, Dinefox and Demeton. Coming to the examples of aryl organophosphates. Parathion. Give me the examples of aryl organophosphates. Clothion, diazinon, paroxane, and methyl parathion. Parathion, clothion, diazinon, paroxane, and methyl parathion. These are the examples of organophosphates. Now coming to the inhibits acetylcholinesterase enzyme, that leads to accumulation of acetylcholine, which leads to various muscarinic and nicotinic symptoms, and also penetrates CNS. So it also leads to neurological symptoms. All the body secretions are increased. Basically, it's very easy to remember the signs and symptoms of organophosphate poisoning. All the body secretions are increased. So you can just make the list. There are various mnemonics also: muscarinic symptoms, nicotinic symptoms, and neurological symptoms. The muscarinic symptoms, just remember the mnemonic: dumbbells, diarrhea, urination, meiosis, bradycardia, diarrhea, urination, meiosis, bradycardia, bronchial secretions increase. Bronchial secretions increase. Then emesis, lacrimation and salivation. Emesis, lacrimation and salivation. Can tachycardia occur in organophosphate poisoning? Yes. Because of the nicotinic symptoms, sometimes instead of bradycardia, tachycardia can also occur. Sometimes because of the nicotinic symptoms, instead of bradycardia, tachycardia can also occur. Tachycardia and muscle fasciculations. Tachycardia and muscle fasciculations. Okay. The neurological symptoms are very variable. No need to take a list. They are very non-specific symptoms. How is organophosphate poisoning diagnosed? Do we measure the organophosphate levels or the cholinesterase levels? Cholinesterase. We can measure either RBC or plasma cholinesterase levels. Okay. Organophosphate poisoning is diagnosed by measuring cholinesterase levels. Cholinesterase levels are increased in the blood. What's the antidote? What's the antidote? Atropine and oxime. Atropine and pralidoxime. Pralidoxime.
Sir, what is the diagnostic cholinesterase level?
What is the
Diagnostic cholinesterase level?
Diagnostic cholinesterase level from the organophosphate level, though it will vary with the type of organophosphate poison, which organophosphate was there. It will vary on that. It can say to 20% of the normal. You can say 20% of the normal. I don't remember the values. 20% of the normal is usually considered to be diagnostic. In carbamates, oximes are contraindicated. In carbamates, only atropine is given, not the oximes. In carbamates, only atropine is given, oximes are not given. Okay, carbamate poisoning as such is similar to the organophosphate poisoning. The difference is, carbamate poisoning, the difference is, first of all, the carbamates do not penetrate CNS. So, no neurological symptoms. Carbamates do not penetrate CNS, so no neurological symptoms. Second is carbamates spontaneously hydrolyze in 24 to 4. In carbamate poisoning, acetylcholinesterase gets reactivated spontaneously in 24 to 48 hours. In carbamate poisoning, cholinesterase spontaneously gets reactivated in 24 to 48 hours. Whereas in organophosphate, they do not reactivate spontaneously. In organophosphate poisoning, cholinesterase enzyme do not reactivate spontaneously. Coming to the question number 2. What's the answer? How many of you say A, B, C, or D? What about the rest of the class? No idea. What's the answer? Answer is C. May arrest with warrant. See, whether warrant has to be, okay, I will explain like this. Offences are of two types. Cognizable offence, and please no side talks, and non-cognizable offence. Cognizable offence and non-cognizable offence. cognizable offense are in general, just to for the basic purpose of understanding, they are more serious offenses. Cognizable offenses are more serious offenses, non-cognizable are less serious offenses. It's a subjective term. Cognizable are more serious offences, non-cognizable are less serious offences. So warrant will be required in which one of these? Suppose a person has committed a murder. Police officer comes to know he has committed a murder. So will he wait for the warrant to be issued to catch him? No, no. So warrant is required only in non-cognizable. To arrest a person, warrant is required in non-cognizable, not in cognizable offence. Warrant is required in non-cognizable offence and not in cognizable offence. Examples of cognizable offences are murder, rape, dacoity. These all are cognizable offences. See, I was looking for, but I was not able to get an exhaustive list for what are cognizable offences. But this is a general idea. These kind of offences are cognizable offences. It has got nothing to do with a grievous hurt. Whether the hurt injury is grievous or not, it has got nothing to do with the issuing of the warrant or cognizable offence. Okay. In this particular condition, simply two people are fighting, and in the fight, the jaw is broken. It can happen with anyone. Okay. You must have done that. So the answer is it's a non-cognizable offence. Answer is C. Question number 3. What's the answer? How many will say A? Okay, first of all, for the IPC, I will say mistake the students comment is, suppose a question on IPC comes, 4 choices are given. There is no need to go through all the 4 choices. This is your tendency, na? Then you solve any MCQ. You not apart from solving that MCQ, you also try to go through all the 3 choices, so that question can come in different form. In IPC, you don't have to do that. There is a list. There is a list of IPCs, important IPCs. I have given in the soft copy. You can ask him to provide you the list. You just have to go through those IPCs. I am not sure. See, as per the IPC, there are around 500 IPCs in which punishment and fine is given. You don't have to. It is even a person who passes LLB cannot remember all those IPCs. You don't have to remember all those IPCs. There are few IPCs which are important, which you should know. Okay, you just have to go through those IPCs. In this particular condition, 226 is important, that we will discuss later on. 227 and 229 you need not remember. 228A is the answer. 228A IPC. The actual answer is 228A IPC. It is for punishment for disclosing identity of rape victim. Punishment for disclosing identity of rape victim. Suppose a person publishes the name of the rape victim in a newspaper or in an advertisement, anything, and by any means, the identity of the rape victim is disclosed by a media person in a news channel. The same section 228A IPC can be applied. What is the punishment under this section? Up to 2 years. Punishment is up to 2 years. Punishment is up to 2 years. Question number 4. How many we say A, B, C, D? What about rest of the class? It's a typical question. It's not a difficult something out of the box. This type of question has been asked for past 3 or 4 years. What's the answer? if you look at your papers in the past 4 years, this is the type of question which is most commonly asked. How to calculate the distance of the victim from the firearm. How to calculate the distance of the victim from the firearm. Please remember the features of the firearm entry wound. Are abrasion collar. As the bullet enters the body, it abrades the surrounding skin. This is called abrasion collar. As the bullet enters the body, it abrades the surrounding skin. This is called abrasion collar. Second is, as the bullet enters the body, the lubricants gets wiped off onto the surrounding skin. As the bullet enters the body, the lubricants gets wiped off onto the surrounding skin. This is called grease collar. Oblique dirt collar. These two things, abrasion collar and grease collar, they are always present. So they do not tell us about the distance of the victim from the firearm. Abrasion collar and grease collar are always present irrespective of the distance of the victim from the firearm. So they do not tell us about the distance of the victim from the firearm. The features which tell us about the distance are singeing. Singeing occurs due to flame. When the gunshot is fired, flame is produced, which causes burning of the hair. This is called singeing. Fourth is blackening. Blackening occurs due to smoke particles. Blackening occurs due to smoke particles. Fifth is tattooing. Tattooing occurs due to unburnt particles. Tattooing occurs due to unburnt particles. So singeing, blackening and tattooing tell us about the distance of the victim from the firearm. If we talk about the distance of the victim from the firearm, there can be 4 different scenarios. One is contact wound. Number 2 is close contact wound, also called near range wound, also called close range wound. Close contact wound, near range wound and close range wound. Third is intermediate range wound. Fourth is distant wound. Contact, close contact, intermediate and distant. See, all these ranges are subjective. You don't have to remember any values. Many of your guides say close range is up to this distance, intermediate is up to this distance. You don't have to remember any values. What you have to remember is when it's in contact with the body, it is a contact wound. Slightly away near range, more away intermediate, and very far distant. These are all subjective terms. Now, singeing, blackening and tattooing, are they present in contact wound? Singeing, blackening and tattooing. Are they present or not?
No.
How many of you say no? Singeing, blackening and tattooing, they are not present, please don't write this decision, not present around the margins. But they will be present inside the track of the wound. Okay? Now, please listen, when in a question nothing is specified, whether it is asking about the around the margins or inside the track of the wound, it usually means around the margins. It usually means around the margins. If nothing is specified, it means that they are talking about whether the singeing, blackening and tattooing are present around the margins or not. So in contact wound, singeing, blackening and tattooing is not present around the margins because everything will go inside. the flame, anything, it will not, they cannot come outside. Everything will go inside the track of the wound because the gunshot is in contact with the body. But they are not present around the margins in contact wound. In close contact, yes, they are always present around the margins. Basically, when we say singeing, blackening, tetanus, we mean whether they are present around the margins or not. So in close contact, they are always present, singeing, blackening, and tetanus. In intermediate range,